not the explanation. Yeah. And the other question is what you can contribute to the US healthcare system. So we have done with, so today, if we are done, after the call, we'll be done with the 6 questions. Tell me about yourself. Second one is why US healthcare system. Third one is why you wanted to be a doctor, your strengths and weaknesses. And the last one is then the 3 words your friends, family, and mentors will describe you. And the last question is what you can contribute to the US healthcare system. So the questions are not that big today. So if somebody wants to talk about the weaknesses first, yesterday Dr. Om told that we need to talk about weaknesses as well. So if somebody wants to go with the weaknesses, they can first start with the weaknesses. Do we have Indu with us? Okay. So should we start with, okay, anybody wants to talk about the weakness, or we can just take that at the end? Should we begin? Like, I think maximum people have joined. We won't be expecting more people than this.
Ayushman, so
Yeah.
I went to a webinar. Sorry, I attended a webinar yesterday, and there was one question somebody had asked, like if the program director or the interviewer asked, "What did you omit from your application?" Like if they want to know more, so just like keep it at the end, not now. We'll finish these two questions, and then probably we can discuss about that.
Sure, sure. Yeah, we can, of course. Yeah. Even there's one more question. Some program director asked somebody last year, previous year applicant, that how, if given a chance to structure a curriculum for the program, how would you do that? That's even a very good question. Yeah. So should we start with the 3 words that can describe you by your mentors, family, or friends? Somebody wants to start this? Do we have Indu with us over here? Okay.
I can start, Ayushman.
Sure, go ahead, Dr. Manasa. Yeah. Thank you. Go ahead.
So 3 words that my friends or family would describe me would be dedicated, detail-oriented, and jovial.
That's very good. So you told detail oriented, jubilant.
Jovial, like fun, yeah,
Okay, yeah,
and then dedicated, yeah.
dedicated. Okay, yeah. So that's how your friends will describe your family, or your mentors will describe you. Okay, perfect.
Yeah.
Anybody else wants to answer about this question?
Yeah, I can answer it.
Go ahead. Go ahead.
Calm, hardworking, and foodie.
Okay, calm, hardworking, and food. But Sarthak, yeah, that's even a very good answer. But yeah, if somebody asks you like how your mentor will define you, then you don't want to mention about these things. Like
Yeah,
food.
then like hardworking, honest, and calm.
Okay, that's perfect. Like depending upon the who's going to describe you, you just have to
Yeah.
change your answer because the mentor won't tell that you're a foodie, right?
Yeah, but my friends and family will say that.
That's a perfect thing. Like there's not much controversial question over that, so that's a good
Yeah.
answer. Yeah. Anybody else wants to go with something?
I can go
Yeah,
next.
go ahead, doctor.
My friends, family, or mentors would describe me as helpful, cheerful, and loyal.
Helpful, cheerful, and loyal. Okay. And what about if your mentor won't say that you're loyal, right? He has nothing to do with your loyalty.
Yeah,
So how
true.
would then you can just change that word?
Uh, yeah. Then my mentor would describe me as
Helpful.
dedicated,
Yeah,
helpful,
dedicated.
dedicated.
Yeah, dedicated is the right word.
Yeah, but these are like very common words.
But that's fine. Like, see, अब जो
Mhm.
qualities हैं, वो उसकी qualities हैं, right? Just to make yourself different, हम तो अपने से, मतलब ठीक है ना? These are
Mhm.
the good qualities you have. Like that is what the program director somebody would be looking for.
True.
Ayushman, can
Okay.
we record?
Yeah, go ahead, Sarojini. Yeah, go ahead with your answer. बोला ना
Can I go ahead?
Yeah, Ayushi, just go ahead with that. Like, continue with your answer. Yeah, Dr. Surya, I hope you're just recording the session. Okay, perfect. Yeah. Ayushi or Sarojini, whoever wants to speak, just go ahead.
Can I speak?
Yeah, go ahead, Ayushi, please.
Yes. Okay. So my friends would describe me as helpful, cheerful, and loyal, and my mentor would describe me as helpful, cheerful, and dedicated.
That's a fine, good answer. Yeah. Yeah, Sarojini, go ahead.
My friends would describe me as reliable, hardworking, patient.
Yeah, that are the good qualities. That's good. Yeah, Uday, you want to answer something? I missed you yesterday.
Yesterday, I had some errands to run. That's why, like, I had to go. But the things that I would describe myself are obviously my friends describe me as dedicated. That's the first one. Always cheerful and reliable. But the thing I understand about these all things that everybody has the same features overlapping each other. Would they ask for any specific situations? Why your friends describe you, or why your mentor describe you as loyal or something?
Yeah. That's the same as your strengths because we discussed the strengths and the weaknesses yesterday. So basically, these
Mhm.
are your strengths. So if they ask you something, then we can just come up with the example, right?
Yeah, we've just spontaneously run.
Yeah.
But that's the thing that I would describe. And the same thing like dedicated, cheerful, but loyal mentor.
Perfect. You don't. We just don't have to make our answers complicated. We can even answer them this way, right? So yeah, it's a like somewhere. Okay, okay. Unaiza, you want to just go ahead? Just go ahead. Yeah,
Can you hear me?
yeah. Go ahead.
Yeah, hi everyone. So my family would describe me as the light of the family, funny, and hardworking. And my mentor would describe me as a good listener, hardworking, and resilient.
So I'll just answer my question. So my friends would describe me as somebody who wears a smile very well, who is easily available even at 3 a.m. in the night, and thirdly, who is very trustworthy. And my mentors would define me as somebody who is very innocent, who is very hardworking, and somebody who is always ready to learn. Yeah. Okay.
Aishman, I think it's like only 3 words.
Yeah, it is 3 words. Yes. I could just find an adjective for them, right?
Yeah.
Yeah, I can say something.
Yeah, sure. Go ahead and look, please.
So, friends will look at us with a different perspective. Family with has a different angle to see us, and of course, our mentor will have a different criteria or parameters to define us. So, yeah, so I can say it in 3 ways that my friends. Okay, let me start with mentor. My mentor will say. Uh, 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 3 words that will the how your mentor will define you. uh, I think proactive, confident, and committed. And how my friends will define me: charismatic, confident, jubilant. And how my family will define me: affectionate, honest, responsible. Done. I'm done.
Yeah, that's a good answer. Yeah. So I just came up with the words. My mentors would describe me as somebody who's very curious, who is a keen observer, and as somebody who's very hardworking or dedicated, something like that. My friends would define me as somebody who's very extravagant, who just plans everything really well, and somebody who's trustworthy. Yeah.
Extravagant, okay.
Yeah, I just got that title when it was a farewell in my fifth standard. I was going from a junior school to senior school. So at that time, I was given this title, Mr. Extravagant. So I just came up with this word from there.
Okay.
It means just like I'm a little bit more curious about everything. So yeah.
Extravagant also means we spend more generously, like
Yeah.
that.
Yeah, I do spend a lot of generously, so for sure. Yeah, and who's somebody who's like a little bit who has more energy and like he's more talkative and stuff. So that suits me really well. Yeah. Should we go with the next person, like your qualities? Yeah, the next person. Anybody wants to come up with the three words that define you? Okay, right. Vanessa, you want to speak something? You just raise your hands.
Oh no, it's from before. Let me sit down.
Okay, perfect. That's fine. Okay, nobody wants to talk about this question again. Like we're done with the people, those who are going to answer, because it's a very small question. Like you just can later on come up with example if they ask it. Why? Yeah. So should we move to the next question? Why US healthcare system? And then we can just maybe like after that we can discuss about some previous question or practice that, or we could just go specifically about the weaknesses. Like Dr. Om yesterday requested to talk about that. Dr. Om,
Ashman, I was looking at the AMC website yesterday. So there are a couple of questions around 30, 40. Did you get any chance to see those things?
I saw them. Yeah, I saw them. I have them. Even I have the list.
So, okay, I'm okay. Like nowadays we are like discussing 2 or 3 questions per day. So I think we have, this is eighth day of our discussion. I think, right? 8th or 9th.
No, this is today's 13th, right? So I think it's
Yeah.
10th day. Yeah, it's 10th day, 10th or 11th day. Yeah.
Yeah, because I remember from the first day. Okay. So what I'm saying is like maybe in coming days we can quickly in a fast pace go over all the questions
Okay.
so that we cover the whole cycle.
Yeah, we can just do that, of course. Like
All right.
we just should be try to cover it by 20th, so that after that we can just start with our specific preps depending on interviews, number of interviews we're going to get.
Yeah, but it should be before by the beginning of next week, because we can't wait for 20. Today is what, 13th, right? Already.
But tomorrow and day after tomorrow, I'm not going to be having the session because Vijay is going to
So
have,
from Monday onwards, we can plan little intensive.
yeah, maybe 3 questions per day would be
More questions than we can cover in a day, and that too at a faster pace. Like then, because we all are now well versed with things, how things are flowing.
Yeah, we
All
can
right.
definitely. We'll work on that, and thank you so much.
Just to like I completely agree with what she said. Just to piggyback off of it, like it'd be like, I think it'd be like more beneficial for everyone if we focused on like, the questions that are harder to answer. Because like again, it's good that we, spend time on the three qualities, but it's fairly straightforward, right? There's not too much it's not that complicated. Like for example, a few meetings ago, we had that discussion about when was your ethics compromised? And I think that was a really good discussion, because it's one of those questions where like you can get trapped very easily. You can say something that's not appropriate or like, problematic. So I think it'd be better for all of us, like if we focus on those kind of questions, like weaknesses or that.
Yeah, exactly. So basically, yesterday somebody suggested the question, and that's why I know it's a very small question, but yeah, you told that weaknesses have to be discussed. So I just wanted to keep 2 questions per day so that everybody gets a chance.
Yeah, absolutely. Like I'm not saying we shouldn't discuss these questions, like just the time, like priorities.
Yeah. I think we're done with this question. We can just shift to weakness, and then what we can contribute to the US healthcare system. Right. So anybody wants to talk about the weaknesses? Like Dr. Om, do you want to go ahead with that?
Just give me a few seconds, right? I had it yesterday. I thought of something, and then like I I forgot. I'll just like flesh it out a little bit. I'll come back like after maybe like a couple of people mention this.
Okay, like we can just do that at the end. Right now, we can just discuss why US healthcare system, and then we can discuss about the weakness and maybe the
Yeah.
how future.
Sorry.
Yeah.
When you mentioned like why US healthcare system, you mean like why? What do we contribute? Like, was that the question? Or like why?
We have discussed why US healthcare system yesterday, and from the same question we can come up with the answer. What is the difference between your US experience and the home country experience, right? It's going to be simple points. We just have to talk about, like, we have to just frame our answer, right? So now the question is what you can contribute to the US healthcare system.
Yeah.
Before you go further, Ayushman, can I quickly interrupt? You said, when did you do those questions like autonomy of residents or parameters to evaluate a resident? How does first month of residency looks like? Like I see this on group, on the IMG interview preparation group.
Yeah.
So when did you do those questions? Any clinical trial? And
we basically do like up to 10th, like 10th of October, we were doing the questions. We were doing the discussion, right? We were just coming up with a new idea how our ethics are being compromised, a good, interaction with the patient we had, or like how we can deal with a patient who has lost his trust in healthcare, or a difficult patient. Then we even just came up, it's basically autonomy of the resident. These are the questions we can ask the residents or our program director during the interview.
I understood, but some of the questions are like okay, that's why like we'll jot down in a one time, and we can quickly go over all the questions. Like one of the questions, why you among 200 applicants?
Yeah.
And as you talked about ethics, which was compromised, so I'm not very good with that question. Like I don't know what to say, and why you, like some of the questions, why I am only like that. Okay.
Yeah. So we can just keep that for 16th. We can discuss these three questions, like why you amongst 200 applicants, or why should we take you. Second one is your ethics are being compromised, and the third one is we can just choose that at the end of the day. Yeah, but we'll keep 3 questions per day so that maximum we can cover by 20th, right? Even if
so can they ask us about weakness? Okay, but can they ask us about red flags?
About red flags, yeah, they can ask you. We can discuss about that as well.
All right.
Okay. So do you want to discuss today, like when your ethics were compromised? We can discuss today because we are done with one question and we just have one more question left. Right.
So we have you arrange that you are hosting it, so you manage the time so that we can cover many questions.
So after 10th, 10 o'clock, we'll just go with why US healthcare system. Right now, just let's go with the why ethics. When do you feel your ethics were compromised? Right. That's again a very important question.
Okay.
So, should I start with the answer? Like what I have, like my incident with why my ethics were compromised?
Yes,
okay, or Aishi, do you want to start? Go ahead.
No, I don't have a situation like that. So maybe I'll listen to others. Thank you.
Okay. So yeah. So that's a very interesting question, Dr. K. So during when I was working as a medical officer at Narayana Hospital in suburban area closer to my city, in the outskirts of my city, at that time I had an experience where I felt my ethics were compromised. I was working as a medical officer in the department of nephrology, and I was looking after a patient in the emergency department who was a dialysis dependent patient and had presented in the emergency with a fluid overload. But at that time, he was having shortness of breath, edema. But yeah, he could understand and talk. He could understand everything and can even, talk to. Was able to talk to everyone. So he had a dialysis the previous day, but today he had a fluid overload, and he needed the.
You can mute.
Just give me a second.
ऐसे करता है ऐसे करता है ठीक है बता देता हूँ ले वो हार्ड ड्राइव ले वहाँ पड़ी हुई है बिल्कुल मैं लाऊंगी उठो तभी
Give me a second, I'll mute somebody. I'm not. Yeah, I think they are muted themselves. So yeah, so that patient was a well-oriented time, place, and person, and was able to understand and communicate. But at that point of time, we had ordered a dialysis for that patient, and we explained everything to him and his family. after explaining them, counseling them, his family agreed for the dialysis, but the patient didn't agree for the dialysis. And unfortunately, we couldn't force him to undergo dialysis, and we lost that patient out of fluid over. So over here, I felt my beneficence was surpassed by the autonomy of the patient. So yeah, that's one of my experience where I feel my ethics were compromised.
I have a question. So, since we respect the patient's wishes, right? He did not want to go for dialysis, but you still regret for that. I mean, could you say again, why do you feel for that patient?
Because my ability to treat that patient in the best possible way was surpassed by his autonomy. I feel like my ethics were compromised, or my duty towards that patient was compromised because I had to, respect his autonomy.
Okay.
Yeah. So that
Ayushman, in that scenario, because I think in this situation, ethics is not being compromised because you're upholding autonomy. And for example, if any patients come, a cancer patient come on even on first stage, and he refuses chemotherapy, and I don't do it because autonomy supersedes everything. I don't think I'm compromising because he understands the condition. He knows it. And he's actively just trying to. I fulfilled my basically job by telling him what are the benefits, what will be the risks, and he says no.
but I am just trying to answer where I felt my ethics were compromised, where my capacity to treat the patient was surpassed by his autonomy, and we lost that patient. So I'm just trying to say that otherwise your ethics will never be compromised. Like because I'm not never going to tell a point where I did something wrong.
Yes.
Right? I have to just tell
passively something went wrong. I didn't do actively. Yes, that's the tricky part in this question.
That luckily I didn't get a chance to do something actively wrong because I am into this career for a very short time, right? I'm into practice 2 years now, right?
Yes.
So that's my way where I feel my ethics were compromised. And my benefit was my ability to provide the best care was surpassed by the patient's autonomy. So yeah, anybody wants to talk about like their experience? I think yeah, exactly. Like it's a better word. I was in an ethical conflict. Yeah,
that's more appropriate. Yes, that's more appropriate.
Otherwise, like there's no other example I can give where my because I'm not going to tell them that why that I actively did something wrong to the patient.
Yes.
Right?
No.
To answer that question.
Yes.
Right.
You have to maintain a certain way.
I think I have one if you let me go.
Go ahead, Dr. Sabia.
So thank you so much for that question. I actually remember a time where my ethics were compromised, or at least I felt like my ethics were going to be compromised, and I took an action after that. We had been examining this child with CP, and we were a group of students. It was during my medical school rotation, and we kept asking every time a medical student would examine the child, we'd ask for permission to examine the child. And then one of the residents made a very crude remark regarding how the child was nonverbal. So he was like, why are you asking for permission? You don't need to. It's not like he can answer back. And he got a few laughs from one of the other seniors. And I remember at that point feeling so ethically disturbed, you can say. And at first, for a few moments, I kept silent because he was my senior. But then I remember I was like, I just can't stay silent. And after that round was finished, I went and spoke to the resident. I was like, no, that wasn't right. It shouldn't have been done. And I think at that point, I realized that talking to your seniors, if done in the right way, can actually be really good for you as well. So yeah, he actually went and apologized to the patient, which was a really good thing for me.
Anybody wants to add something to this or give your feedback?
Maybe Saiba was a little past. Saiba, what was the main issue with the child? Could you say briefly again?
He was a child with CP and he was nonverbal. And then the resident made a joke about the fact that we couldn't take permission from him. So why are you taking permission? Then I corrected him.
Okay.
So I had a feedback. I don't think it is appropriate to say negative about our colleagues or residents, it would come out as we are we are judging them. Even if they did it wrong, we should frame it in a way that, we are not judging them or putting them down.
Yeah, I tried to make it sound like I went and spoke to him separately, so I thought it might be okay, but I get where you're coming from, definitely.
But yeah, Sabia, I think the question actually defines your ethical responsibility, that you're very responsible ethically.
So as in, I should change the answer, or is the answer okay?
Like it's there, then everybody will be just left like with an answer that they wanted to give a treatment, but patient left against it, because then we don't have anything else to talk about, right? So I feel that might be a good answer, because I
Okay.
don't think any answer is wrong or right, right? Like even the program director might not like my answer as well.
Yeah, okay, that's great.
I think you're right, Ayushman. In this scenario, I don't think there is a right answer, and everybody will just like cave into like autonomy versus beneficence. Look, that's
Yeah.
the But in this scenario, the one you described, Sabia, is that what ethics, like which part of your ethics was compromised on this? Like the resident told you not to ask, but you still like corrected the resident.
So
You
at first,
upheld your yes,
I
yes.
at first didn't. So I'm trying to make it look like they were compromised for a bit, but then I went and I fixed. I'm trying to do it that way. I don't know if that will work, but yeah.
Okay. So there's one more
No
example.
answer is the right answer, yes.
Yeah, I think that's a good answer, Sabia. You can just mention that, because no answer is right or wrong. It just shows that you have a lot of empathy towards your patient, and that shows one of your qualities, right? And over there, we are just over there to showcase our qualities at the end of the day, right? Our every answer should be like a little bit showcasing our quality in one or the other way, be it the leadership roles that we take, be it the empathy we have, or be it being generous, or any other qualities that we have, right? So I think it's a good answer.
Yes, I feel that, Sabia, your answer is really good. I just wanted to point out that, just so that it does not come out as negative. But other than that, the answer was really nice. You can use this as ethical dilemma.
And plus, I feel Ayushi, she's not trying to put down somebody. She's just
Mhm.
sharing experience with a colleague. Like it can happen with
Yeah.
anybody, right? But
Yes.
it is good that she took an initiative and corrected that person. That's what they expect
Yeah.
from us in the clinical practice, right? Like if we see
Right.
somebody
Right.
doing wrong with the patient, we have to, first go and have a word with him and correct him, right? Then after
True.
that,
Even if,
take it to the higher
yeah, that's true.
authorities if it doesn't happen. Though it doesn't happen in
Yes.
real life, but that's what they teach us
Yeah.
during the USMLE step exams.
True. That's true. Also, I had a question. What if we were never in an ethical dilemma? What do we do? Because I cannot remember of a thing.
Get up.
Like, is it
Create a
possible?
situation.
But wait, but can we say that fortunately I've never been in an ethical dilemma?
Let me
Because
think about that for a second. You can say that, but
yeah,
in this situation, they're asking specifically from your clinical experience, like 2 years, 3 years, whatever
mhm,
you have. That have you ever
yes,
faced? And obviously, the answer cannot be I cannot recall
no,
instance
yeah,
something like that. You have to think of something beforehand.
something. True, true. That's so true.
Yes.
I agree
Thank
with
you.
Ayushi. This is very like tricky question, ethical dilemma. Guys, give one or two more examples so that I can really get
Okay.
clarity on it.
So I don't have an example. That's not my example, but we discussed the day. Like on like the previous day, we discussed the same question. Somebody came up with the example that that person was working in a emergency department of a big private hospital. So there was an accident, right? And that patient was stabilized and treated there in their emergency department. But after stabilizing the patient, they had to, now the patient couldn't afford the further treatment. So they had to shift the patient to a different, government center. And that doctor said that I had to do it in spite of the fact that I knew that his or her care will be compromised in a certain way in that hospital, and he would be getting the best care in the hospital she was working at, right? But she couldn't do anything over there because like a patient couldn't afford the treatment. So like she felt that I feel I was ethically compromised at that time because I was
So we are like kind of helpless. We can't do anything, but we feel ethically compromised.
yeah.
Hmm.
That was example that even I like, because I think many of us have a similar examples that we happen. We don't recognize those examples for sure, but Well, because we never knew that we are going to sit in the interview and they're going to ask us the ethical questions, right? Otherwise, we would have noted these things. But yeah, but we can just come up with an example like this. We can just think if something like this happened to us or not. Like maybe because of finances, patient couldn't afford, or we had to refer him somewhere, or something like this example. Yeah.
Got it.
Yeah, or even when I think at least in the hospital I worked in, we could find something called a LAMA or a DAMA, where against medical advice they leave. That also sometimes feels very ethically wrong, where they need the treatment and you just have to let them go because they want to leave. So again, it's a bit of the autonomy thing, but then that could also be used, I think, in the ethical dilemma part.
Yes, that's a nice example. It's very common, and yeah, it's a very nice
Because
answer.
it happens a lot of times, like even I did my house job in psychiatry, it even happened there as well, right? Many times to the patient. So if I have to think, then there are lots and lots of examples I can come up with, right? Maybe like you don't remember it actively, but you must be having some kind of like this incident with you, which you can just free for your answer. Yeah. So anybody else wants to just share the ethical question?
I think it's better to answer the question itself, not to just say that I don't have an ethic. I've never been experienced to an ethical dilemma, because I think the interviewer himself will be wanting to know if you actually can recall something that happened. Because most of us, even if you're newly grad, you've been through something. Because even back in our country, in the US, there at least one situation where there's something ethical dilemma. That's number one. Number two, even the interviewer wants to know how, even if you're not the one in the ethical dilemma, maybe it's your senior, maybe it's your colleague, but the interviewer wants to know how this ethical dilemma affected you, and maybe it's thinking that you're not involved in it, but your colleague have been involved and he told you that this happened and this happened, and you give your colleague the input. So I think it's better to come up with an answer, even if you were not actually in an ethical dilemma here.
Yeah. And with these questions, they just want to judge whether we have actually worked or not, right?
Yes, exactly.
That's what the interviewer wants to judge, that we have actually worked or not, right? Because many people will just write for the sake of mentioning, they'll mention in that CV, and people don't work at the end of the day. Many of them, they don't work, right? So they just want to know whether you have worked in that situation or not.
And even that they know that you know what an ethical dilemma is, because if you say you don't have, how does he know that you know what an autonomy is, what non-maleficence? He doesn't know.
So no answer is correct or no answer is wrong completely.
Yes, but at least you
answering it's your understanding of that question, and it's your individual incident that we have.
Yeah, exactly.
Yeah. So Dr. Fawzi, you want to share your experience?
Okay, so during my residency, internal medicine residency back in Egypt here, I was had a rotation in the intensive care unit, and one of the patients had to be intubated, intratracheal intubation, because his oxygen saturation was decreasing. Okay, and he was losing consciousness. So we could not take the consent for intubation, as well as it was an emergency situation. And because it's in an intensive care unit, there was no family members there. So we had to intubate without consent. It's an emergency situation, okay? But when the patient himself, after the oxygen saturation was met and we intubated, we started waking up. He tried to pull the intubation, okay? Because it's irritating his windpipe and his throat. So there's something called a restriction order, which means that you tie the patient's hands to the railing of the bed, so he's not able to pull the intubation. This is against his will, because the patient did not want to be restricted, but it's for his own benefit. And when the family members came to visit the patient and they saw him restricted, we told them that it's for his own good, because if he removed the intubation, it's going to be hard to intubate him again. So although in this situation, it seems that we went against the patient's autonomy not to be restricted, but it was for his own benefits. Yeah.
Good.
How does this sound? That's good.
There's one feedback in that you should add some mic, or you should even speak like loudly, because you have to be more clear. That's what I feel. I think there might be some issue with my laptop as well, right? But you can just add some mic, or you can be a little bit more loud so that you are better and one is able to understand you better, right?
So my voice is not clear.
It was not clear. I think it might be an issue with my laptop, right? I don't know. Like
No, Ayushman,
No,
I
he's
think
not
like
that clear.
it's with everybody. Like we cannot hear properly.
Oh, okay. So it's not clear on my end, yeah.
Like it was difficult for
We
me.
cannot hear it clearly.
Yeah.
Yes.
Oh, okay.
It was not very clear.
Okay. Okay.
Like I just got a few idea. Like I just had an idea from your answer that you were talking for some in your you were talking about ICU setting and the intubation of the patient, but I understand the answer completely.
Okay.
Yeah, I had some feedback regarding that, Fahmed. I think like make the answer a little smaller. Maybe it was a little too detailed. There was a lot of explain what everything means, and I think they'll understand. They know they're also doctors, so they'll know what you're talking about.
Okay.
So I think find every little bit so that you can make the answer a bit smaller.
Okay. Okay. Thank you.
Guys, I need a feedback on this. Now I can remember something. Like you can tell me, is it an ethical dilemma or something? So when I was posted in a ward, there was a poor and homeless person, like who was admitted in the ward. But I realized that every day we used to do he developed back sores. We used to do the dressing and all. But since he was homeless, no family member ever arrived, and his condition got deteriorated day by day. And I felt like ethically in dilemma those days, like wish I could do something more for this patient. So is it now my question to you guys, is it an ethical dilemma or like feeling of helplessness?
No. I'm sorry, but no, I don't think that counts as like an ethical dilemma because you did the best you could, right? Like everyone sometimes feels like they wish they could do more, they wish they could do better, but like as long as you did the best you could at that time, I don't think this would count as like an ethical like this thing.
Okay.
That's my thought.
Okay.
You're on mute, Ayushman. We cannot hear you.
Yeah, and you just go ahead. You can just frame it in a better way so that you can just change your example. You can just change that little bit, right? But
give me an idea what the change like.
Dr. Oma has better ideas. I think he gives.
Oma, you tell me.
Okay, maybe. Okay, say maybe if you can like if I had to like rephrase your this thing, maybe I would say something like you said the person was like he was like poor, right? Like this thing. So maybe there was like a treatment for him that like that he couldn't afford, but it would like really helped him. And then maybe like at that moment you place like too much emphasis on his like economic like on his like financial issues rather than like maybe focusing like you didn't give too much, like you gave too much of a priority to his financial issues and maybe didn't recommend or like stress that like this treatment would be helpful for him, something like that. Like I mean like this is if you wanted to still go with this example, if you come up with another example, maybe that can go.
Yeah, let's say I want
one
to
thing.
What is the ethical dilemma I can frame here?
You can just say it that way. That patient, was discharged, like he was treated, given the treatment, but he didn't have clothes and stuff, and he was discharged. And later on, I felt very bad, right? That I couldn't help him in any way. At that time, I should have helped him.
Like financially, you mean?
Okay, can I?
Yeah, go ahead.
I want to just say, you could frame it in a way with an ethical principle of equity. Say that like he was a homeless person, we had some other people who were like normal stated, and there was a treatment difference between them. And I tried to correct it. I tried to make this with the same. You could just use that.
Oh yeah, that's a much better this thing. I would definitely go with that.
And that
That
would
sounds
be a
good.
very good question. Apart from this beneficence, and the other one is this, that's a different example, like Dr. Sabia have talked about, right? It should not be only about beneficence and autonomy. That's a very good answer to this question. That would be like something different.
So
And
Ayushman, when
Yes.
you said discharge the patient, this poor patient, so does it mean I felt that I could not help him financially? Do you mean?
at that time you didn't take the right decision, but once he's discharged, you just had a regret in your mind that I wish I could have helped him or her.
Helped him in what way? Financially, you mean?
Yeah, maybe financially or something, or yeah, you could have sent him to a better NGO or something like in that way. You can just frame your answer.
Oh,
Or as
NGO or something.
yeah,
Okay.
as Dr. Unaib said, like difference of the treatment. That's even a very good example.
Right. Okay.
Right? So yeah, Dr. Anjali, go ahead with your answer.
Can I add something into it?
Sure, go ahead, Dr. Agarwal. Yeah.
I want to say that if the bed sore example, you can take that, but instead make the patient like incapacitated or don't have healthcare proxy, and you were in an ethical dilemma, how to proceed with that patient. That would be, instead of taking the financial aspect into it, I think so. As a physician, we must balance autonomy, beneficence, and non-maleficence into a frame like with judgment also. So you can take it example in the way like the patient was incapacitated or don't have healthcare proxy or don't know what to do, and he was deteriorating, and you were in ethical dilemma. Now what you will do into that very scenario. I think so that would be a better framework into it. That's what I feel.
It's a good point too.
Yeah. So into this frame your answer well, like Dr. Unaib said, that point that we read in one of the, like, for 4 or 5 words we have. So in this we have one point that we have to treat everybody equally, right? And Dr. Agarwal even gave you a very good idea. Now it's you who has to decide and frame your answer, right? The onus of framing is on you.
All right. Thank you.
Yeah. So Dr. Anjali, go ahead with your answer. Then we'll go with Dr. Purnima and Dr. SP. Yeah. Yeah, go ahead.
So I haven't framed anything. It's just an example which came into my mind, and so I'm just discussing it. You just tell me that if it's right or not. So I was during my second year med school rotation in the outpatient clinics. I mean in the inpatient clinic in the medicine department. I was
Dr. Anjali, your voice is breaking. Your voice is breaking.
Sudden patient deteriorated, and the patients in a quiet room. And now, hello, hello, am I audible?
Your voice is breaking.
Hello, yeah. Am I audible now?
Yeah,
am
now
I audible?
Yeah, I don't know. Like it might be an issue with my network.
No, it's an issue with my network. Sorry.
Now
Okay.
You're audible. Just go from starting quickly. Yeah.
Yeah. So I was on my second year med school rotation in the medicine department, and I was working with the faculty, and all of a sudden a patient deteriorated. Patient was shifted to ICU, and before shifting to ICU, my faculty told the patient's relative, took them into a quiet room to explain them the poor prognosis of the patient, and the difficulties patient is having, and what happened all of a sudden. So he took them in a quiet room, and he he applied a spikes protocol and tried to explain it. And in between, one of my friend, he and I just got a talk, and he didn't tell us on that moment, but after properly explaining the prognosis and after the patient's relative left, he taught us about the spikes protocol and how important it is. And at that point of time, I came to know that how the spikes protocol is important, how it is attached with the emotional and sensitivity of the patient and patient's relative. And at that point of time, I broke this ethical protocol, and I'll make sure in my life that I'll never do it again. Yeah, how?
Comment on that. I just searched what spike protocol is. Anybody wants to comment on that? Give their like opinion on the ethical experience of Dr. Anjali? Puneb?
Uh, Basically, I didn't like solely get the scenario. Can you like just repeat that after the spikes protocol, what was the main thing that was like ethical dilemma in it?
So, actually, during our med school rotations, when we are posted in inpatient department, usually we don't focus on the sensitivity and emotional part of the patient. We only focus on the medical things which we want to know. We don't really focus on the counseling part or the emotional things which are attached with the patient's relative. So that day, our faculty explained us how important that part is too, because apart from treating the patient, the other big aspect is explaining the prognosis and counseling the patient. So you have to follow proper protocol to explain them, and you should not break that protocol. It's attached with the sensitivity and emotional things with the patient. So that helped me to cultivate that thing in my mind that now onwards, I will look into this matter and I'll not break this protocol. Or it taught me
Just
a
one
thing
point.
that
One point in all the scenario, in second year rotation, you were a student. You were not a
yeah
practicing doctor. You were learning.
yeah, so that is the thing. I didn't break the protocol, but in a way, if I am interrupting someone or my faculty, or I'm disturbing the faculty who is explaining to the patient, in a way it's kind of a break of ethical, maybe. And it's just an example.
It's a good example, but the only thing that's like, it's purely my opinion, is that we all were like this in our med school, right? We were learning. We
Exactly.
didn't
So
know.
some
We
or
were
the
just
other way
focused
we
on
would
the main
have
thing.
done this. So some or the other way we all would have done this, and we would all have broken this protocol. Because at least we are a doctor. We are not, I mean, even though we are student, we broke this protocol. We broke this ethics part.
Yeah, so in this situation, you can use this whole scenario. Just say that when I first like entered for the first time in the medicine ward, I was also like that. I started just focused on the patient symptoms, but like my seniors or whatever taught me how to do this, and from then on, I never made that mistake again. I always
Yeah.
resolve the concern. That way, it will show that your ethics were compromised. You were learning, but you learned it.
Yes.
Now you have used it
Yes.
in your practice. Use it like
Yes,
that.
yes. So that way I learned that, and that day our faculty taught us how important this thing is, and that way I have started using the thing, and I'll never compromise it
Yes.
again. Yeah.
Yes. Yeah. Use it like that. That's a good one. That's a bit unique.
Yeah, that's again
Yeah.
different. Like instead of just beneficence and the autonomy thing, like these are the unique aspects, right? Yeah, Dr. Purnima, or then we, yeah, Dr.
I want to share something regarding ethics. I think it is
Just
ethics
go ahead
related.
and be a little bit more quick, Dr. Raki, because I think we have more students. Yeah, just go ahead with your answer. Thank you.
Who's can I speak? It's Jaya.
Yeah, just go ahead. Just go ahead. Like, but just
Okay,
be
so
okay.
okay, so it's not a clinical, like it's just my with my someone with my friend as a personal experience. One of my friend one day she has just talked me. She was married and she was pregnant with a third child. So she was calling me and she texted me and talk about me abortion pills. So I couldn't decide whether I should make it prescribe the abortion pills or just counsel it that it is not good or it is unethical. What? So I just gave his one of gynec number, and I just said that talk to him or her. So I don't know like what in this situation what should I do, what should have to do, or what ethics scenario has been compromised. So I just want to like make a frame in a little bit storytelling way. So can you guys please just give me a feedback? So like what I should
That is
say?
sure.
Yeah,
That is
please.
a very good scenario that you have picked up, because in this situation, your ethics were really into question because she was your friend and she
Yeah.
was asking you as a medical professional for something that is considered unethical. Like make
Yeah.
the like say like she is 3 or 4 months pregnant, right? So it would seem more
Yeah.
serious to her. You could say that. Now that is the answer. What did you do? Either you said
Exactly.
that, first of all, just say, I wanted to know why was she asking about this. I wanted to get into the depth of her situation. Why was she asking about abortion pills? Like mentally, I was trying to like get into the head. Why was she?
Okay.
So did something happen? Did any scenario happen? Did she had a fight with her husband? Something like that. Just make it up because you
Okay.
did your part. That shows that you did not like, because she's a friend, you just wrote down a prescription for her, right? Then you just
Okay.
go with it that I referred her to the like gynecologist or whatever. But you have to show that you did your part. You asked about why is she asking about abortion pill in 4th month of pregnancy.
Okay. I've asked, but like her reason was that she has only 2 children and she doesn't want to third child. So this is the basic reason that she can't afford that much, and she just got pregnant by chance, and she had not planned. It was unplanned pregnancy. So after that, she has forced me to write a prescription. Also, she has forced me that not to tell anything about her husband or her family member, because I know personally her family members and her husband. So it's a kind of confusion situation that in I was that what should I do? So I'm just can I just mention in an ethical situation or a frame in a better way? I just want some feedback that how should I present, like what my role should be in regard to this answer.
Was Dr.
This
Rakesh?
question.
Sorry. May I?
Yeah,
Ayushman? Sorry, the thing is, I just want to like generally for this topic, I want to clarify something. Are we like, is the question asking us when we had to make a difficult ethics situation, like a decision, or is it when our ethics was compromised? Because like in Dr. Jaya's like example, like it was a difficult decision to make. I understand that, but I don't think her ethics were compromised in this thing. She ended up making the right call at the end to like refer them to a gynecologist, because even though she's a friend, she doesn't know the friend's medical history, right? She can't just like blindly
Yeah.
prescribe like medication or whatever without getting like a proper with like outside of a proper clinic setting. So
Yeah.
again, that's the thing. I think she made the right call. So I wouldn't say her ethics were compromised, but yes, this is a very difficult like ethical situation. So again, moving forward for like all the examples, I think it's best to clarify like what exactly is the question here.
This is a very good example for the question of ethical dilemma, not ethics compromised. That is the main thing.
Okay.
Yes.
Exactly. So for
Ethical
ethics
dilemma.
compromised, I think it should be something where you actually made or like, you know, carried out or like just made the wrong decision at that moment. And then maybe you correct it later along. That would be a good way to like move forward with
Okay,
it, like, you know, explain it. But like,
can the
again,
situation
you should have made
can
the
the
mistake.
situation Okay, can the situation be an answer for ethical compromise if I am frame a little in a different way or not?
No, I mean,
No?
again, I don't see a way I can do it. Like maybe someone else has a way that they can reframe this, because in my view, you made the correct call at the end. And I don't see
Okay.
any way that like you can make it seem like you made the wrong call without also making it sound like pretty problematic. I can't think of a way. I'm sorry. Maybe if like someone else can, that'd be like great.
Exactly. The only way you
Hey,
could
hey,
frame it,
hey,
which will
guys,
be way
Gunab,
problematic.
hey
Yes,
guys,
yes. Please, please,
now
please.
now the conflict. The question was, when your ethics were compromised, was it really compromised, or did you feel compromised, or you feel helpless? Because ethical conflict, ethical dilemma, moral distress, these are all synonyms. So did it really happen? You did something wrong. That's the question, right?
Yeah.
Yeah, exactly. That's the question. It should not be only like your ethics were compromised, but you were in a difficult situation and you had
Yes,
to,
at that time I was like, should I call to her husband or just to make her to the one
Jaya,
of
did
the
you get this
gynecologist.
Refer to someone.
Yeah, refer to someone. So I couldn't decide, and I was just confused at that situation. That what should I
And
do?
Jaya, the
And
one
she
thing
was
is that
forcing
you
me to
should
not
just,
to tell anyone.
yeah, exactly. And one thing that you should mention is that I was a practicing doctor at that time.
Okay.
Though it was out of your clinical setting, but you were a practicing doctor, and
Yeah, yeah. I was.
yeah. So you just have to. Otherwise, like I don't feel like everybody. It is not necessary that somebody will be having a, when where there's an ethical conflict. Like the example I told, everybody's going to have that example in their life. It's your personalized experience that you had, right? Like this is experience that happens with us also many a times. Like some of my friends will call me for something, but I don't want to prescribe them.
Exactly. The family members also contact you regarding this, and you were not able to answer there. Like, what should
You are
you
stuck
do?
in a situation that your very good friend was there, and you want
Yeah,
to help her out, but yeah, you were bound with your ethics.
exactly. So, what was
I,
the?
I have one suggestion for Jaya. Jaya, maybe
Yeah.
I think about that husband part. I think you should mention that you prefer like the patient's privacy than the family relation, because I know that okay, she forced you not to tell her husband, but you felt that okay, no, they are like family member and I want to tell them anything, but still you prefer to choose the patient's privacy, that
Yeah.
I should not do, like I should not tell and to her husband.
I didn't tell anyone, but I have make her realize that you should talk to your husband, your
Yes,
family.
yes.
Maybe
So you
she will come with
convince
a
her,
he
and
will come
yeah,
with a very good like decision or any answer. So I have just
yeah. So you
convinced him, and
convince
then
her.
finally she has just talked to her husband, and then
Yeah, but
going
you
to
at least,
gynecologist.
yeah, you didn't like you didn't tell her. So I think that is
Yeah,
positive.
and Jaya, you were very good friends with her husband. Also, both of the family, you were like family friends. So even you knew
Yeah.
her husband very well, but yeah, you prioritized more privacy of the patient over anything
Yeah,
else.
privacy to
Because
the
the
patient.
family,
That
yeah.
is the important part. Yeah.
Yeah, you can just
Okay.
frame it like that. Yeah. So now should we move to the next person, Dr. Anjali, then we'll move to Purnima, then Ayushi, and Dr. Habiba. Yeah. Dr.
Ayushman.
Yeah, Purnima, go ahead.
Yeah, so basically, this is not exactly ethical dilemma. Like, I'm not sure what this is. This is just a thought. I want to know if
Just
it
go
comes under
ahead. Just go
ethical
ahead.
dilemma. Yeah. So basically, during the COVID first wave, I was working in the casualty, and then I had there was a limited supply of ventilators and stuff. So we had to prioritize patients and then do triage. So that was kind of a very difficult decision as to which patients to choose to ventilate, because based on their life expectancy and the seriousness of their condition. So will this come under ethical dilemma?
You frame it in the way that at that time a lot of patients, like it was a deadly, like second COVID wave was very deadly, like especially in India, right? So you are from India, so many people were dying, and there was a shortage of ventilators, medicines, and a lot of stuff. So we had to be very strict on our triage.
Correct. Yeah.
Right. So at that time, I felt that many people, my ethics were compromised at that time because many people were in need of the ventilators.
Yeah.
Right?
But we couldn't give them. Yeah.
So that's my opinion. Like anybody wants to add something to that, Dr. Om or Onaib or Indu or anybody else?
Like you can just say, hey everyone, can I just add to the Purnima's answer?
Yeah. Yeah.
Yeah. So in this situation, if you want to just emphasize on a few ethics, you can just say like there was a close family member affected, and in the meantime, since you were triaging, so it was a kind of an ethical dilemma for me because I've seen my own family suffer, and there are other patients suffering on the other side, making me put in a difficult situation. I guess you can just add the family twist to it so as to make it more impactful.
So basically, specifying that I chose other patients over my own family for the ventilator.
I mean, like your medical judgment was impaired because you had your own family suffering as well. I hope you get my point.
Okay. Okay. Yeah. Got it. Thank you.
Otherwise, it's a very good example. Just frame it in the right way. It's a good example, like where your ethics were. You were in a difficult situation.
Yeah. Okay.
Yeah,
Thank you.
Situation, especially in India, when those pharmaceutical people try to gift you something, and then you say no.
Dolo.
Actually, question is scenario. There are so many scenarios in our head, each like everybody's head, but we can't frame in a right way. So what, like, how to frame in a right way? Is there any app or anything which we can write these things and make a good vocab and with storytelling way? Because
Chat.
there are so many scenarios, but we can't describe in a way that somebody will convey the same thing. So
I
it's a
agree,
little
Jaya.
bit confusing about answers.
You can just
Absolutely
ask
agree.
ChatGPT to frame it for you. Like that's what
Yeah,
people.
ChatGPT has its own words. It's a big, big word. We can't like not remember the ChatGPT
Yeah,
words.
just practice it more. Like just talk to
I,
your.
I have something to say. Yeah, Aishman, you are right. One is ChatGPT, second, like Google, and the most effective is this, what we are doing, talking to each other, listening to, and we are verbalizing our thoughts, and that is the best way.
Also, I have a opinion.
Because this
There is a
session.
website.
Yeah, go ahead, Dr. Ayush.
Sorry?
Yeah, go ahead. Go
There
ahead.
is a website. There is a website called biginterviews.com, which is an AI generated website where we record ourselves and they give us feedback of how our vocabulary was. So maybe you can use that.
Please write the link on the group, please.
You can just type in the
Sure.
link, that will be very helpful. And Dr. Jaya, just practice more and more. Practice in front of mirror. Practice it when you're sitting, and that will add to your this. That will definitely improve your answer.
Exactly. Because there are so many scenarios which come in mind, but I cannot frame in a way that it may be a good answer for this question. So it is a bit difficult for me.
I agree. When Aishman asked me, promptly, then I said, "What are you asking me?" Then my thoughts go haywire.
But Indu, you are very good with your answers, so you don't need to worry. You're very good.
That is a journal we
How you
all.
put across your points and everything, it's very good. Plus, anybody who's
Thank you.
speaking right now takes guts to speak in front of 70 people, right? So you're already doing a very good job. So you're going to do good in your interviews, right? It takes a lot of confidence to speak in front of so many people.
Thank you, Ayushi, for this .com link. Okay.
Yeah.
Ayushi, you want to go with your example?
Yes. Just for the biginterviews.com, I would want to say that they don't frame your answers, but they give a feedback on the answer that you present. So I've not used it, but I've heard about it. So
do
just
you have
letting it out.
do you have an ethical example, or
Yes, I do.
Go ahead.
Yes. So during my internship in India, I was posted in the COVID ward during the second wave of pandemic. And due to lack of resources, we could not provide each patient with a private room. And all the critically ill patients were, or critically ill or even a little bit healthy patients were put together in a single room. And it was very difficult for the healthier patients to witness critically ill patients dying in front of them. And I feel that I was in an ethical dilemma where I could not provide a personalized care to each patient. You know what I mean, trying to say. So do you guys think this was an ethical dilemma, that putting healthy patients with the patients on BiPAP? Like, I mean to say that patients on oxygen masks were put together with patients on BiPAP, and it was really difficult for the patients on normal mask to see the patient on BiPAP mask struggling in front of them, and I could not do anything about it. Yeah, you can be like how it psychologically affected the less serious patients seeing the patients who are more serious.
Yeah,
Yes.
the panic attacks and everything, you were witnessing
Yeah.
that. You couldn't do anything at that time. Like they had panic attacks. Some people used to, even get up in the night, and they sometimes used to shout, or some people used to sweat, or they had tremors. Some kind of, you can just add spice to your answer. Otherwise, you couldn't do anything about that.
Yes.
Because
But was my ethics compromised? Like it was, right? Being a doctor, I should
you
not.
were in a difficult ethical situation at that time.
Right.
Yeah,
It's not compromised, Aishman.
Yeah, it's not compromised at all. It was a difficult ethical situation.
Yeah, I would say like your ethics wasn't compromised at all. Like compromised because like when you say ethics were compromised, like I think the fundamental question you should ask yourself is, was there something I could have done that I didn't do? And then so like in the situation, ask yourself, what is it that you could have done? You as an intern, like I'm assuming this was during your internship.
Yes, it was.
Right? Like, so you are like, in terms of like doctors, you are the lowest rung on the ladder. Literally everybody else is above you. So like, again, I'm sorry, like, but like, ask yourself, like, what you have done?
Right.
When the answer is no, can you really say that there was a compromise there? It was a dilemma, 100%. I agree.
Yeah,
Like
true,
obviously, like as a structural thing, like it is very difficult for patients to see other patients suffering and like to put them in that situation. It's difficult, but I don't think there is a compromise anywhere here.
True.
Yeah,
Okay, but
adding on
can I
this
answer
point,
this in the question? What, like when the question is about when you think that your ethics were compromised, can I answer this? That I believe that my ethics of being a doctor, it were compromised. Like I could not help them, something like that.
I don't think
We can just
so.
start with like if somebody asks
Okay.
you, or you can just ask if
That's
somebody
just my
asks you
opinion.
this
Maybe
question.
someone else has a better
Yeah.
way of saying it.
Dr. Ayush,
Okay.
somebody
Thank you.
asks you this question, you can just say, I don't remember exactly a situation where my ethics were compromised, but I was in an ethically difficult situation.
Yes. Okay.
Then you can start
That's a
with
good
that
way to
example.
answer. Yeah.
Yeah, instead
Okay.
of
Thank you so much.
somebody saying that I don't have any situation where my
Yeah.
ethics were compromised, you can just even come up with an example where you were in a difficult situation. You wanted to help patient out, but you couldn't, right?
Yes.
So
Thank
you
you
can
so
just
much. Yeah,
start
this is a
with
good way to answer.
otherwise if you have example, then that's a good thing. But if you don't have, you can just start it with, I don't remember, I couldn't recollect right now, the doctor, whosoever he is, I couldn't recollect when my ethics were compromised. But yeah, I can just talk about a situation where I can talk about a situation which was difficult for me as a doctor. And I think
Yeah.
it was ethical situation, it was a difficult ethical situation for me.
Absolutely.
Yes.
I
Okay.
second Ayushman's statement here. Like I think that would like work well.
yeah,
Okay.
adding to
Thank you
this
so
point,
much.
adding to this point, I would say like an ethical dilemma can be just put forward in a straight way, like where your best medical judgment has been compromised, I would guess. So that's the best thing where you can just put yourself in a situation and try to say like I should have done this, but my opinion was not the best medical opinion that I've given. So I hope you understand what
Yes.
what,
Yes.
what I'm
Thank you so
trying to
much,
really say.
everyone.
I have a question. If somebody asks me this, that can I answer that once there was a patient, he was very flirty, so I refused to see him or check him? Would be at the appropriate answer?
That's also a part of dilemma, yeah. Ethics, these pharmaceuticals or harassments, they all come under
Yeah,
ethical dilemma.
first you have to find that you are safe or not. If you don't feel safe, so you can say no, that you are not accepting as well. You're not.
You can just say that it was my duty to, I feel it was a duty, it was my duty to provide the best care to my patient. But yeah, for me, my safety was also an issue at that time, and I put my safety over the giving treatment to my patient.
Yeah, if the doctor doesn't feel safe, she can or he can say no.
Yeah.
But I'm asking, does it sound professional? Because I have another example where the situation was that autonomy was passed by due to was overcome by beneficence. So should I use that one, or I can say this example?
So Dr. Bushra,
I think this one can work also.
Yeah. Just go ahead.
Any step 3 questions do you remember? A
Yeah.
doctor can always say no, and the patient care will be transferred to another physician.
Yeah, I also remember that. That's why I say.
Yeah.
Everybody will come
But
up
does
with
this look? It sounds professional.
I just say don't use the word flirty.
I think it sounds professional. I think that sounds like completely fine. It's like something that quite a few people experience. I think that would work. Yeah.
Like you can contact your supervisor that you can't be able to provide the care, and he will make sure that the care will be transferred to another.
Yeah. Yeah, you can just, and I think everybody will have example with beneficence and autonomy. Everybody's going to come up with example. You should just come up with something different, right? So it's a very good example, and it happens with everybody, especially with the girls. When somebody touches you in an inappropriate way, or they're just trying to flirt with you, or have pass some gestures, inappropriate gestures. Definitely at that time you have to take some action. So you have to put your safety above the providing the best care to your patient.
I have
just mentioned one thing in the end, that even though the care was transferred to another doctor, I still looked at his reports to see whether he's getting the appropriate treatment. That way it will show that you're not just abandoning your duties.
Okay. Yeah, perfect. Yeah, so we'll shift to the next person, like
And
Dr.
Ashman, I have one more question. There are behavior questions which are very difficult to answer.
We can come
So,
up with that in future. Like we have a lot of days and it's a free session. You can just type in the chat box and we can take it the next time for
but
sure.
there are 200 plus question about these behavior and situational things.
We can just, yeah, we will we'll try to cover maximum, because we are, like, it's a free session and we can just do anything, right? It's not, we
But
don't
my
have
question
to.
is, are there any free other resources where we can just check the answer?
See, there's no appropriate answer to every question. Everybody's going to have a different answer to that. You can just go through more and more videos on the YouTube. Like there's Malke Saath, he conducts mock interviews. I think there's one more Pakistani channel who conducts the mock interviews with the students. You just listen to them, listen to their answers, and then you can use those points in your answer. Nobody.
Actually, I
It's
saw
really,
them,
yeah,
but
it's
what
really
they are
good.
doing is they are just covering the general one, like introduce yourself, your weaknesses, your strength, why US healthcare system. They are not covering the behavior ones. So I found them very difficult because coming up with the answer spontaneously is very difficult, and you don't know whether it will sound good or not.
Okay. So we
Can
can
we
just,
start with behavior?
yeah, we can just try. Right now, there are three more people in the queue. Then we can discuss about this question, right? Because everybody will get a chance here. Dr. Uneza, Dr. Om, and
Guys, can you know where is the PDF of the questions actually?
Indu, can you share that in the group? That AMC PDF?
It's in the WhatsApp, right? WhatsApp group. So,
Okay. And
So
also, I
Ashman, if
am a
I share the
gynecologist. Actually, I'm a gynecologist and I have a patient who is bleeding profusely and refused C-section, but then I went for C-section to save the mother and the child. So is there any compromise or anything here? But I definitely didn't respect her autonomy.
Yeah. Yeah, exactly. That's what my example was. Is your example is completely opposite to that. So your ethics, like you gave more importance to the patient's life over her autonomy, because she could just die out of bleeding. So that's a good example, even. And that would even mention about your work as a gynecologist. Anybody else?
Ashman, if
I
I
would,
share the
say
PDF
like,
with you, can you please include that question in the
Sure,
session
sure.
as well?
Just send me. Just send me. I'll definitely do.
Okay, thank you.
Okay. Yeah, Dr. Siri.
sorry. To the previous person who mentioned that this thing, I think you can say it as like a ethical compromise, but I would like really sell that, like how you learned from this thing, and then how you read on multiple books, or like you went through multiple resources to understand ethics, and then this thing, because like this is like one of the, like I would say this is probably one of the most complicated ethical situations a doctor can face, right? So like I think you can use it as like an ethical compromise thing, but I would like really like this thing that like how it affected you, and then like how you like chose to like really like improve yourself and like understand how things work. That it should show that you're taking this very seriously.
Or you can just like say patient was able to understand, she was well oriented to time, place, and person, but her vitals were fluctuating. So we had to take this difficult decision of to take her to the operation theater for the C-section for her beneficence. So at that time, definitely we just gave more importance to the beneficence over the autonomy to save that patient. Or you can just add that patient was not very well read, so I had to take a decision for her, because you can just frame something like this, and then yeah, as Dr. Om said, you can add that to your answer. Otherwise, it's a good example. Yeah, Dr. Om, you just go ahead with your answer, then we'll go with Dr. Unaiza and Dr. Habiba. Yeah.
Good. So mine was something like so I was like, when during my internship I was also helping like on the side with one of my PG's like research projects. And like since I spoke the local language well, like he asked me to take like consent from a patient, and like they also had some like other forms that they needed to sign, like for like MRIs and stuff. So I had like the forms in one stack, and so when I went to the patient, I explained like this thing to them. I completely forgot about what do you call it? This thing, his research, the consent form, and I had it like as one stack. So after I explained it to them, I got signatures from all of them, and like I got the sign on the consent form as well. without like explaining anything to them. And the patient also didn't realize, they just thought it was another form that needed to be signed. And then once I like went, like I finished my rounds, I like went back. And then I realized that I had this like consent form without like that was signed, even though like I didn't explain the consent to the patient. So I went back to the hospital after hours and then I explained it to them. And they were very understanding, and they just started laughing. They like said like, we trust you, doctor. Like, we know you'll do the best thing for us. We'll sign. And though I was happy at that time that like the patient didn't feel bad, I then realized like, I was gonna say like I brought it up with like the PG or like who was conducting the research, and like they told me that like consent is very important and this could be very problematic, and then I would need to go this thing. So I like chose to like go and like mention like explain it to them, and then like give them the option to like take back the paper or like refuse to consent to the study if they wanted to. They were fine with it, but then like that day I like learned the importance of like informed consent through for everything, right? And like I learned also that like I need to like compartmentalize better, be more aware, and like take notes of like my work so that I don't miss something like this again. So does anyone have any thoughts on this?
I think that was a good example, especially because I faced something similar where like I was trying to get consent for a surgery, but they also said like just get the anesthesia consent also. So but it was good that you went and you tried to correct the situation and go back and like try to explain it to the patient. So I think that was a good example, and also like is unique to you. So I think it was definitely a good example.
And plus you learn from that, and you just try to incorporate that into your practice in future. So it's showing that you are a good learner. You learn from your mistakes, though it didn't cause anything big at that time, but it could have led to something like it could have led to something difficult, but unfortunately it didn't, and you learned from it and you just use that into your practice in future. So that's even a good and unique example.
Thank you. That's the thing, right? Like, because it's a compromise, I thought it was a compromise. It's fairly simple. And like, it showed that I took immediate steps to correct it when I realized that I could, right?
Actually did
So
what
I think that's why I like wanted like to use this, like, it's like a simple, well-rounded example.
That is
All right,
what
thank you. If anyone else has any other points to add, like, please go ahead. And thank you for your like feedback.
And the example is similar to that happened with like somebody told during the second year of medical school. That happened and she learned from it. So the example is similar to that, and it's a good example.
Yeah, awesome. Thank you so much.
Yeah. So should we move to Dr. Naisa and Dr. Habiba? Dr. Naisa, just go ahead, then we'll go shift to move to Dr. Habiba. Yeah.
Okay, I've not a well-structured answer, but tell me if it's right. When during my internship, it was my first week, and the hospital I was working at, they had a local language. Like a lot of patients were speaking Sindhi, and they would know this, so it's a local language. And because unfortunately we didn't used to have translators, and I had like somewhat command over the language, and I thought I could speak to patient and like counsel them myself rather than asking the native person to maybe talk to them because they have better command over the language. And one time I was taking consent from this patient and tried to explain it in their language, and I was not well versed and they refused it. But then when I brought up my colleague who spoke native language more, they were more clearly, the patient actually agreed to it. So will this be a good example?
Somebody wants
Hello?
to give feedback, Dr. Om or Uneb or Indu, or anybody else wants to add something to this?
Once again, I'm sorry. Like I just had to step away for a bit to do something. Could you just like quickly run through what the example was again? Like I'll let you know.
So basically, where I did my internship, or the large amount of patient population spoke local language, which I had like I wasn't I had like not full command over it, but I know some of it, and I tried. And we didn't used to have translators, so I thought I could just go ahead and consultation myself rather than asking the native speaker to help me. And when I went there to ask the consent for a procedure, they refused it. Maybe probably because they did not understand what I was trying to say. And when I brought my colleague who spoke fluently that language, the patient actually agreed to it.
I think that's
So
a
where
pretty
is
good example.
Yeah, but the ethics are not compromised. It's a kind of asset. Knowing extra language is an asset, right? So
No, the thing is, her ethics was compromised in the situation because she chose, like, even though she didn't speak the language fluently, she chose to like take it upon herself when she should have resorted to using a translator. If I'm understanding the example correct, right?
Yeah, even I feel that way. Like you are just trying to, trying to
Yeah.
mean
Yeah.
that, you shouldn't take the responsibility when you know that you don't know that language well, right?
Yeah,
I think
exactly.
that you took the responsibility and talked to the patient, and patient couldn't understand it, and he said no. Then you had to take a help from your colleague, right? And then he could
Yeah.
explain that patient in better in that local language, and then that patient agreed to the procedure. Yeah,
Yeah.
that way it's a good example.
Yeah, I think it's a really good example. Same thing, like ethics compromised, like it was caught, you corrected it, and you learn from it. Like again, like I would add like a couple of points at the end and like how you learn from it. Maybe like you could say like you chose like you understood not to take risks, or self reflect on like how good your skills actually are, and then what you can do and can't do, and then appropriately like adjust for the things that you can't do, and like you took measures to learn the local language a little bit better.
Okay. Yeah,
Yeah.
So that you can further like function in the future, and something like that. Just a couple of lines on like how you reflected on this experience and improved. But yeah, I think like it's a very good example
Thank you.
overall.
So yeah, just before moving to Dr. Habiba, we'll just Indu or anybody can come up with the ethical questions or the questions you want in the next meeting. Just come up with 3 questions, and you just
yeah, quick question I have. So sometimes the patients, children, I mean the parents refuse for the vaccination, even in India, out of fear or whatever they heard from somebody. So that is a part of ethical dilemma. We want to vaccinate the child. We want to, like they are the future, but we are not able to do because of the parents' choice. So does it come under ethical dilemma? But it's a dilemma, but my ethics are not compromised, right? So how can I present it?
So Indu, your ethics are actually compromised because in that situation, the autonomy lies in the hands of the parents, right? So you have
Right.
to give importance to the autonomy of the patients over your beneficence.
Okay.
That's even a very good example. Like my beneficence, like me treating my dialysis patient or ordering a dialysis for them, was surpassed by the autonomy of the patient. So you, in the same way, you wanted to give the vaccine to the child for his being, and so he doesn't catch up diseases in future. But it was surpassed by the autonomy of the patient by his parents.
All right, makes sense. Thank you.
Yeah. So Dr. Habib, so Indu, just anybody just it's a good to talk about the ethical questions or whatever questions you want to discuss. Just write that in the chat box. 3 of the questions we'll take up in the next class. Yeah, Dr. Habiba, please go ahead.
Hi, good afternoon, everyone. This is the first time I'm attending this session. So first of all, I would like to confirm that these 2 questions are different. Like there is ethical dilemma, and the second one is a situation where your ethics were compromised, right?
For me,
yes, they are 2 different questions.
Yeah.
Well, similar, but they're different.
Okay. Thank you so much for answering. So in ethics compromised, we all have scenarios, like the similar scenarios wherein the patient's autonomy surpassed the beneficence we wanted to give to the patient, right?
I think that would be ethical dilemma rather than ethical compromise, because like patient's autonomy does supersede like beneficence almost like always.
Yeah.
Unless some very select circumstances.
That's an ethical.
So
all right.
if you have to, that is an ethical dilemma. It's a difficult decision, but you still made the correct one.
And Dr. Habiba, we would never talk about like we compromise our ethics. We would never mention that during our interviews because like obviously we wouldn't show that we had done something wrong even after knowing, even when we knew that it was wrong, we did it, right? So it's just like when they ask a question like this, we're going to tell it in a way that it was an ethical dilemma, it was an ethical conflict.
All right, sure. So I have this particular scenario in my head. Like during my internship, I had seen a case wherein a girl who was 18 years old. She had this miliary tuberculosis. So I then recalled that the family, they visited the pulmonary medicine department few months ago, and she was kind of having some symptoms of fever and weight loss. But at that time they declined the test, they declined the treatment, and they went away. And then again after a few months, the same girl, she came with febrile seizures, and this time like she had miliary tuberculosis. So how could I frame this particular scenario? Like, how could I do this?
So like you can just say that I was in that clinic, like in a month I was in particular, I was posted in that particular clinic. So I saw that patient before and I talked to the parents, like I told them that it can be probably a tuberculosis, but they weren't ready to accept it. And maybe like a month later, or like they presented with a presentation of the miliary tuberculosis. So at that time, again, you just had to give the priority to the autonomy of the patient, beat their parents over your beneficence. For
So
me,
yeah, this comes under ethical dilemma again, right?
it's an ethical dilemma or ethical conflict. There's no demarcation between these terms, right? It means that it's a difficult ethical situation for us where we
Yeah, right.
the patient, but we couldn't because there's the importance of the autonomy or other aspects as well. Like there are certain
Right.
things that are not in our hands. We wanted to help that person out, but we couldn't because of the circumstances and the ethics in position. Yeah. So,
Yeah, right. Okay, got it. So I
something?
can just frame my answer like for the question of conflict or dilemma for my this specific scenario. But then what should I answer when I'm asked when was your ethics compromised, or tell me about a situation when your ethics were compromised?
See, I would never say my ethics were compromised. I can just say I don't remember any situation when my ethics were compromised because I don't want to bring that. To be very honest, I don't have that situation, and I don't, even if I have, I don't want to talk about it. I would say I don't know exactly when my ethics were compromised, but I know a situation when I was that was ethically when I was in a conflict. I would say it was a conflict for me, and then I can come up with the example.
All right. So, can I use this example, or you guys have any better suggestions for me?
It's a
If you want to like frame this, if you want to frame this as an ethical compromise, what I would say maybe something like the patient was 18, correct?
Yeah, 16 or
So
18. I don't exactly remember the age.
I mean, like if you say 18, then like you can say something like, at least this is what I would like, what's in my head. Like you could say something like, she came in with her parents, and then like in front of them, like when when she was offered all these tests, she refused it. And like maybe you didn't like realize that like maybe there's some pressure from the parents or something. So like you at that time maybe you should have like taken her aside, like spoken to her privately and asked her if she wanted to, because at 18 you're allowed to make those decisions for yourself, right? So like even if then if she still didn't want to take the test, that's fine. But like I think like that this thing that like maybe you should have taken her aside to make sure that she wasn't being pressured or she wasn't like nervous or something to like agree to these tests in front of her parents. Maybe you can mention that as like a potential, like you can use this example as like a potential ethics compromise, and like you can speak a couple of lines on like how you learn from it, how to like read the situation a little bit better, and like how to understand, like to do a thorough job and like informing patients of their like what they can do and stuff like that.
Yeah, all right. Thank you. But then what if the same patient is like 15 or 16 years old?
Think like I mean, like again, that's the thing, right? Like these kinds of ethics, these things, like really depend on like where you did this. Because in the US, I think like at 16, like in certain situations, you have such autonomy. But like I don't know how it works in like different countries. Like so it really has to be like it's country specific. Like it's based on like where you worked. So I think you would have to look that up
In
to
India,
see.
I'm 26. I still don't have autonomy. My parents are going to take a decision for me.
True.
That is India.
Yeah. But yeah. So Dr. Habiba, what you can say is the patient is 16, so she is in a situation to understand the thing, right? So you can just don't take an ethical decision on her own, but you can just say that I regret that I didn't talk to her personally or something like that at that time. So I might give her a better treatment for sure if I talk to her like she was never pressured, she was not under the pressure of her parents, right? So something like that. Yeah, you can just frame your answer like what Dr. Om said. He's right, so I won't say anything after that.
Yeah, right. So I can still use this scenario for any of the ethical dilemma or ethical conflict or any of the other questions that we discussed so far, right?
Yeah,
Yeah, absolutely. Oh, sorry. I was just going to say, like, absolutely. I think like it fits both. Like, just rephrase like how you say it, and like for everyone's examples, I think you should just add like a couple of lines at the end on like how you reflected on the situation and what steps you've taken to improve. Because I think really with this question, that's what they want to see. Like, yeah, like stuff happens. Like like people make mistakes, so like they want to see like what you did to like learn from it and like how it affected you and stuff like that. So yeah, I think like focusing a little bit on that would be better.
They just want to know whether you know that you did something wrong. Do you appreciate that? Right? Do you first recognize that you have done something wrong? And from that, they want to make out whether you have worked or not. Right?
Yes.
So no question answer is perfect, but the thing is they just will get an idea about your overall personality. Like you have various qualities like empathy or maybe other like some people are firm. So it just gives an idea about your personality and whether you have worked or not.
Right.
Now, before moving to Dr. Akash, like he's the last person, we'll be taking the example form because then we'll end the meeting. So anybody can tell the questions. Indu, do you have the questions in your mind, the ethical ones or any other questions you want from
I
that?
don't have a question, but I can in less than 30 seconds, I can summarize something. Some more ideas I can give 30 seconds.
Or Indu, like you can take the onus of just writing the questions. Like maybe I'm not perfect at that. You might have a better knowledge. You can just type that and group the 3 questions.
Sure, I will type.
Right, you can just type 3 questions, we can just prepare. So tomorrow and on 14th and 15th, Vijay is going to have a session. Like he told that he's going to have a session with a radiology residents who used to work with Match a Guy. So he just requested me not to have a session.
I asked him, are you sure? I asked him yesterday, he said, I will let you know.
Okay, then what I'll do is I'll first get in touch with him. Like I'll ask him whether he's going to conduct a session or not. If he's not going to conduct, I'll just text right now in the group that whether the session will be there tomorrow or not. Otherwise, when there's a session, I won't conduct because that's what he requested me, right? And he told that we might learn from his session, like because they are experienced radiology residents. So yeah, Dr. Rajani even told a good question. Yeah, so Dr. Kash, please go ahead with your.
Yeah, so I'll just not take much of a time. So this is basically I'm just pointing out towards the ethical compromise. I experienced a situation during my internship, I would say, when I was during my in the ER posting. So a 20-year-old boy just came down when he met with an accident. He was under the influence of drugs, basically. So the first things first, when he just entered into the emergency room, his request was not to tell anything to the parents or something like that. And but even though it was not a lethal accident, by eventually I ended up telling the parents because of the pressure from the family side and everything. So I would say there was a breach of confidentiality of the patient. So I feel like this was an ethical compromise from my end. Any inputs on this one, I would be happy to know. Thanks. Yeah, anyone can please feel free to correct or
No,
add.
Akash, I agree with you. I had a similar experience, like in these kind of like where the motor vehicle accidents or somewhere like patient, let's say that patient is more than 18 and he must have asked you not to reveal this thing to his family.
Yes.
But there are some conditions where we have to breach that, right, guys? You just please enlighten us.
Yeah, so
Yeah, sorry,
do
that's
I
the thing I wanted to
categorize
mention.
this as
Oh,
an
sorry.
ethical compromise? Do I categorize this as an ethical compromise? Yeah, please go ahead.
Sorry, that's what I meant. Like the thing is, this it's a bit of a technical question, right? Like in this situation, the patient was incapacitated, correct? Like were they unconscious like after the accident?
No, he wasn't. He was not unconscious, but he was able to make his own decisions and converse
Okay.
properly.
Oh, okay. Then I think in that case, then yeah, probably you could mention this as like an ethical compromise, because if he was incapacitated, he was unconscious. I'm not sure. I'm not like very clear on how that works. Maybe you'd have to check it out.
Yeah,
But
thank you
yeah,
so
if
much
he
for
was
that
awake
point,
and like alert
actually.
and like able to make his own decisions, and then you still under the pressure of the family, like disclosed his medical information to them,
Yeah.
then yeah, I would say that that's